Good morning, Excellencies. Good morning, Natalia. Welcome. Thank you for joining. We're a few minutes before 10. We'll be beginning shortly. And just a gentle reminder for those that have yet to do so, to please, using the rename function, if you're able to indicate your country affiliation, that's very helpful for moderating the discussion following the Executive Director's statement. Thank you very much. All right, good morning, colleagues. Thank you very much for joining us. We'll be beginning in just a moment, as soon as the chair is ready. And again, thank you for joining us for this segment this morning. And we will, again, just a reminder, if you haven't yet done so, to reflect your country affiliation using the rename function. If you haven't yet done so, that's just very helpful for the moderation. So Ambassador Webson, if you are ready, we can hand over to you to begin proceedings. Hello, Ambassador Webson. We have 122 people online. So as soon as you're ready, Ambassador, we're ready to begin. You're on mute, Ambassador. You're still on mute, Ambassador. If you're able to unmute yourself, there you go.
Unmute myself because the host muted me. Anyway, you're hearing me now, are you?
We hear you perfectly. Thank you.
Can you hear me?
Yes, Ambassador. We're hearing you perfectly.
Okay, great. Thank you very much. Good morning, Excellencies, colleagues, friends, everybody. Good morning. Good morning. Good Wednesday morning. I declare open the fourth virtual meeting of the second regular session of our board for 2020. And today we of course will be looking at dealing with UNOPS. The meeting is now declared open. Excellencies, distinguished delegates, colleagues, members of the board, observers, I am pleased to welcome you to the opening of the UNFPA segment of our 2020 second regular session of the Executive Board. I am delighted, colleagues, to welcome with us today the Executive Director of UNFPA, Dr. Natalia Cannon, and other members of her team on the podium, the virtual podium with us. We have Mr. Ed Peterson, a long-standing friend, Deputy Executive Director, Management, who is officially assuming his new function. He started only yesterday. I'm very pleased to have you back with us in this new capacity, but to continue the very good work which you started when you were here in your role as ambassador of your country. Welcome. We have also Diane Kieta, Deputy Executive Director, Programs, whom we also welcome as I guess you could welcome to her first board meeting as a newbie to the in her new role. This is her first board meeting in this new role that she is taking on. And the rest of the UNFPA leadership team, welcome. Distinguished delegates, the board will now begin their interactive segment on the statement of the UNFPA Executive Director, and on the item 12, UNFPA Structured Funding Dialogue. We will proceed in the following. The executive director will make an opening statement, which will also provide an update on the UNFPA COVID-19 response, and also introduce the report on the UNFPA Structured Funding Dialogue for 2019-2020. That is DP/FPA/2020/9. Following her statement, I will open the floor for comments from members of the board. I am now, I have the pleasure and I am very pleased to invite Dr. Cannon to make the statement and to present her agency's statement. Dr. Cannon, you have the floor, please.
Thank you very much, Mr. President. Mr. President, distinguished members of the Executive Board, colleagues and friends, greetings. As I address you for the second regular session of the Executive Board, I am really pleased to add my words of warm welcome to Ms. Jenna Keita, our new Deputy Executive Director Program, and to Mr. Ib Peterson, Deputy Executive Director for Management. Jenna and Ib are bringing their unique and complementary skills and experience to the senior management team, and I certainly look forward to their contributions to our work to drive progress towards the realization of the ICPD Program of Action and the achievement of UNFPA's mandate. I extend our thanks to Dr. Ramisa Lakbarov and Dr. Julita Onabenjo for their steady and strategic stewardship of the management and program portfolios over the past several months. It was a time of unprecedented challenges for the organization as a result of the COVID-19 pandemic. I now invite everyone to view a brief video on the themes of our 2020 State of World Population Report, entitled Against My Will, Defying the Practices That Harm Women and Girls and Undermine Equality.
These traditional leaders are FGM promoters. Most of them have received anti-FGM education, but they are still forcing, and they know that FGM is illegal.
Saya menyunati itu dengan cara menjepit klitoris atau bagian sensitif bayi baru lahir, saya jepit.
There is a common belief that women's sexuality is beyond reason. We should begin to think of FGM as an issue that pertains to women's sexuality and the desire to control it.
मेरे को ये तो पता नहीं था 3 बच्चे हैं पेट में, तो डॉक्टर ने अल्ट्रासाउंड के बाद यही बताया कि फीमेल चाइल्ड है तीनों। वो कहते अबॉर्शन करवा लो चाहे घर छोड़ दो, मैंने घर छोड़ दिया, मैं नहीं गई।
My mother used to say if she didn't having a birth for the last 2 boys, she would be abandoned of their own mother-in-law.
In the Caribbean in general, and certainly here, men like to say after 12 is lunch. For a long time, 12 meant you were an adult.
Before I married him, I was like a person and I had an idea of like who I wanted to be. And after I married him, I just didn't even feel like a person anymore. I just felt like, you know, I was somebody's property.
Mr. President, distinguished delegates, the world is a dramatically different place than it was when the United Nations was founded 75 years ago. Looking at progress and challenges since the Second World War, it is clear that we have made great strides in promoting the rights and choices of women and girls, a cornerstone of inclusive and sustainable societies, and of our mission at UNFPA. We also know that the road to 2030 is made steeper now by COVID-19, the greatest global health crisis in a century. Climate change threatens the health, security, and prosperity of people and planet. Conflicts and crises exact a heavy toll. Pervasive racism continues to gnaw at our common fabric, often with deadly consequences. And alarmingly, women's rights and choices have come under threat around the world, with sexual and reproductive health and reproductive rights continually coming under pressure. Yet our life-saving work has never been more needed. And our focus as a public health organization on the front lines, on making change on the ground, on delivering for women and girls has never been sharper nor more essential. Just ask Francia in Port-au-Prince, Haiti. Her fear of COVID infection nearly kept her from seeking maternal health care until a midwife supported by UNFPA taught her how to protect herself when going to the hospital for prenatal care. Or Salwa in Sana'a in Yemen. She survived child marriage, 3 abusive husbands, crushing poverty and extreme hunger. At a UNFPA safe space for women, Salwa received health and psychosocial services and learned how to sew. She now has her own sewing business and makes face masks to help prevent the spread of COVID-19. Betty, a health worker in Kampala, Uganda, distributes condoms in her community through a partnership among UNFPA, local health officials, Marie Stopes, and the popular motorcycle taxi company, Safe Boda. These are just some of the millions of women and girls we support as we move swiftly to respond to the pandemic, nimbly adjusting our programming and our means of implementation. UNFPA works to ensure continuity of sexual and reproductive health services and to minimize supply chain disruptions for contraceptives. We have been sounding the alarm and responding to skyrocketing gender-based violence. And as always, we prioritize those who suffer most, the most vulnerable women and girls. UNFPA has paid special attention to older persons on the ground and in our well-received global convenings. And we've attended to issues of import to indigenous peoples and those of African descent, people living with disabilities, those in low resource countries and small island developing states, or in humanitarian or fragile contexts. As we respond to COVID-19 and reimagine a better future, we must repeat unequivocally that the rights of women and girls are not negotiable, even in times of crisis, especially in times of crisis. Their sexual and reproductive health needs must be safeguarded at all costs, services must continue, supplies must be delivered, and women and girls must be safe from harm. The impact of COVID-19 will likely hamper progress on the 3 transformative results at the heart of our work: universal family planning, an end to preventable maternal death, and the elimination of gender-based violence in all its forms. That is why we are doing everything we can, working hand in hand with UN partners to deliver coordinated health, humanitarian, and socioeconomic responses under the leadership of resident coordinators. As part of the UN Global Humanitarian Response to COVID, UNFPA already has reached over 5 million women and 1.3 million adolescents and youth with sexual and reproductive health services and delivered more than 1 million surgical masks. Since April, UNFPA has procured services and supplies such as PPE, contraceptives, reproductive health kits, and dignity kits for over 107 countries affected by COVID-19. We contribute to the joint UN tender led by UNICEF, another example of increased United Nations coordination. Our country level work continues to be framed around national priorities in alignment with our strategic plan, and we're carefully reviewing work plans and budgets to rapidly respond to emerging priorities. Delays in the 2020 census round due to COVID-19 mean that an unprecedented number of countries will conduct censuses in 2021 and 2022. That's an eventuality that UNFPA is planning for now. COVID-19 also affects our humanitarian delivery. Why are sexual and reproductive health and gender-based violence services still so often sidelined? These are essential services and must be prioritized as such. UNFPA is working to ensure that they are. The lives and well-being of women and girls hang in the balance. I could not be more proud of the way that UNFPA personnel, our strongest asset, are responding to the crisis with resolve, determination, and a fierce commitment to delivering for women and girls. I note with gratitude the service and sacrifice of UNFPA staff, especially those serving in hazardous duty stations. During these difficult times, UNFPA is encouraging managers to exercise maximum flexibility with regard to working arrangements. We've also engaged a duty of care coordinator and staff care support specialists for each region to implement well-being strategies. In response to staff concerns about the racism, inequality, and discrimination plaguing our societies, UNFPA is hosting a series of candid internal conversations, safe spaces for our workforce to have hard, uncomfortable, and certainly illuminating discussions. I've encouraged managers to continue these conversations. I applaud UNFPA staff's willingness to speak up and to listen, and for their commitment to creating a more inclusive workplace. As we develop our next strategic plan, UNFPA is taking stock. We will build on the enormous evidence base we have of what works and how. There are scarcely 10 years left until the year 2030. We count on your support to help us to develop a strategic plan that accelerates progress towards our 3 transformative results in a post-COVID world. A strategic plan that keeps our eye on the prize and addresses systemic inequalities, fragilities, and gaps to build back better and ensure that this time no one is left out or left behind. And a strategic plan that builds upon our collaborative advantage with the rest of the United Nations development system. We are committed to making this process as inclusive and consultative as possible with the board, public and private sector partners, and civil society. We look forward to your strategic engagement. Mr. President, protection from sexual exploitation, abuse, and harassment, PSEAH, continues to be a key priority for UNFPA during COVID-19. With a strengthened institutional framework, our focus now is on enhancing country capacities, particularly in the 14 high-risk countries where UNFPA is leading or co-leading PSEA networks. With UN partners, we aim to ensure sustainable interagency investment and to strengthen implementing partner accountability. The new partner PSEA assessment tool, developed jointly with UNICEF, the UN Refugee Agency, UNHCR, and the World Food Programme. The rollout of a standardized electronic incident reporting form and service and capacity mapping are identifying gaps and areas for further improvement to strengthen assistance to victims of sexual wrongdoing. I look forward to further advancing this victim-centered approach to the humanitarian sector's response to sexual wrongdoing when UNFPA assumes the Interagency Standing Committee Championship on Protection from Sexual Exploitation and Abuse and Sexual Harassment in January of 2021. UNFPA is currently on the humanitarian front lines in more than 60 countries. In Lebanon, as a key humanitarian actor, UNFPA stepped up immediately, mobilizing expertise, funding, and support to meet the urgent needs of women and girls there after the devastating explosion in Beirut. We are deploying additional midwives, distributing PPE and reproductive health supplies, and procuring medical equipment and drugs to save lives. We have delivered more than 10,000 dignity kits with hygiene items, and more are on the way. We have also deployed additional social workers and counselors to support women whose lives have been fractured by violence. While progress is being made globally in providing GBV services during the pandemic, we are concerned about the limited or lack of services in some areas. Our recent assessment of maternal health services also points to disruptions in essential sexual and reproductive health care with potentially serious implications for maternal and newborn health. UNFPA has developed a body of technical briefs to support and guide our work on issues by partners on the ground. And we have worked hard to ensure national response plans integrate a rights approach, taking into account the specific needs of pregnant women, older people, and others in need of tailored support. Our humanitarian office continues to strengthen procurement and supply chain management, operational and human resources capacity to increase effectiveness and efficiency. We're also taking action to address specific operational gaps identified in the recent global evaluation of UNFPA humanitarian response capacity, an item that we'll be taking up later today. UNFPA appreciates the important strides made by the Independent Evaluation Office to ensure that evaluations are relevant and responsive to the organization's needs and those of the broader UN system through joint and system-wide evaluations. We also welcome the important contributions of the Office of Audit and Investigation Services and of the Ethics Office, which the board took up in the joint segment on Monday. They reflect a UNFPA deeply held commitment to transparency and accountability, to effective governance, and to upholding the highest values and standards of the United Nations, and to improving as we go forward in line with best practice. We are committed to continuing to prioritize the oversight functions that are so essential for our overall effectiveness. Mr. President, gender-based violence is a pandemic within the pandemic, and UNFPA is working to make the Secretary General's call for peace in the home a reality in partnership with 146 countries that have signed on to the call. Drawing on our considerable experience coordinating and leading GBV programming in both development and humanitarian settings, there are a number of areas where we're helping. First is data. Keeping women safer means having reliable data on the prevalence of violence and the availability of services. UNFPA has been able to show that during the pandemic, 65% of countries where data are available have maintained or expanded GBV services. And fortunately, with hard work, 80% of the UNFPA gender-based violence service points have maintained operations with few disruptions. Second point is mobilizing and engaging meaningfully with youth, and especially young women-led organizations. Through our various youth platforms and networks, we can support the scaling up of these efforts. Third, we want to expand the focus on gender-based violence from awareness to accountability. Our communications platforms provide messaging on the availability of GBV services and amplifying existing programs and interventions to end gender-based violence and harmful practices once and for all. I'd like to turn now to the UNFPA funding situation. How gratified I am that UNFPA surpassed resource targets for the past 2 years. Adequate core funding continues to be essential to our efforts to complete the unfinished business of ICPD and champion the rights of women and girls. The flexibility from our core resources was the reason we could immediately and effectively respond to COVID-19. It enables us to plan and to adapt to shifting global challenges and countries' changing circumstances and needs. The fast tracking of 2020 payments by several donors made all the difference. Now, with additional commitments from a number of countries, we can project strong core resources this year, 2020, at just over $400 million US. Distinguished members of the Executive Board, I must emphasize how much we appreciate the trust of our partners during these times of hardship. The early payments enhance predictability. For next year, mindful of the projected economic contraction and tightening of the fiscal space, UNFPA appeals to all donors to maintain this level of commitment for 2020 and beyond. We've marshaled our energies to diversify our funding base, reaching out to new donors and making the case for core, demonstrating the unique value and impact of UNFPA implementation funded through core resources. UNFPA also invests core resources in enhancing the coherence, effectiveness, and impact of collective UN action at country level, while continuing to strive for efficiency gains through common operations. Our support for and engagement in UN reform efforts remains strong, including as we collaborate to define new ways of working at the regional level. UNFPA has so far raised around $410 million US in co-financing from bilateral and multilateral sources in 2020, including more than $53 million for our COVID-19 response. As one of 6 entities accredited to help countries execute the World Bank's Pandemic Emergency Financing Facility, UNFPA has received an additional $12 million through that mechanism. In the first half of 2020, the private sector contributed nearly $2 million US in financial aid and in-kind contributions, including $6 million for our COVID-19 response. The regular structured funding dialogues with member states continue to provide a platform to exchange ideas on ways to better link results to resources. In response to the board's request, we've discussed the UNFPA funding architecture within the broader framework of the UN Funding Compact, and we are reporting more granular results. Going forward, we will continue to seek guidance and support from our allies and partners for our immediate and longer-term response to COVID-19 and to address the growing imbalance between core and non-core resources, the funding gaps identified in the costing exercise, and humanitarian programming needs. Mr. President, distinguished members of the Executive Board, UNFPA has proven to be a public health implementing agency of great importance to women and girls during the COVID pandemic. In this and all our work, we remain firmly committed to effective and coherent UN action at the global, regional, and country levels. In this landmark year for women's rights, UNFPA is pleased to co-lead and put our full institutional weight behind the Generation Equality Action Coalition on bodily autonomy and sexual and reproductive health and rights. We continue to build on the momentum from ICPD 25, and I'm happy to report that the enthusiasm remains high. Thousands have responded positively to UNFPA's series of global What's Next conversations on ICPD 25 and the Nairobi commitments. Discussions to date have focused on issues ranging from bodily autonomy to the socioeconomic consequences of COVID-19 to the disparate impact of the pandemic on people of African descent and indigenous peoples. Nearly 1 year from Nairobi, from November last year, we're taking stock of progress against the more than 1,250 plus commitments. The newly formed high-level commission on the Nairobi Summit on ICPD follow-up will meet for the first time later this month to discuss how to ensure commitment makers are on track to make good on their voluntary pledges. Now is the time to stand firm on our commitments, to forge ahead, to back up words with deeds and action on the ground, and for delivery with adequate budgetary allocations and financing. I assure you that UNFPA will continue to stand tall for women and girls. Let's put women's rights and equality front and center now and moving forward on the promise of this agenda like never before. As I close, I wish to recall the brave colleagues and implementing partners, nurses, midwives, doctors, cleaners, drivers, administrators, so many who have paid the ultimate price, their lives, while selflessly giving service this year in the face of the novel coronavirus pandemic. UNFPA will never forget their sacrifice. Thank you.
I thank the Executive Director for her statement. Thank you, Dr. Cannon. Paid great attention to a number of the areas you raised, and I'm sure we would have quite an interesting and important discussion. I will now open the floor for colleagues and for members of the board to raise questions, make comments, etc. And I am pleased to give the floor to Ambassador Rubelitzer of Rwanda for her statement on behalf of the Bureau. Ambassador, Excellency, you have the floor.
Thank you very much, Mr. President. I was having a bit of a hard time unmuting myself. Thank you very much. On behalf of the Bureau, we thank very much Dr. Natalia Kanem for a comprehensive presentation. We commend UNFPA for continuing to shine a spotlight on the rights of women and girls, even as the pandemic has threatened to undermine progress towards the 3 transformative results. Empowering women and girls and focusing on those most at risk of being left behind and left out are essential elements of our collective pandemic response and for building back better. We note UNFPA's quick and agile response to the pandemic, which has seen the organization produce evidence-based technical guidance, estimate the potentially high impact of the pandemic on the 3 transformative results, and adapt and repurpose programs and resources to help both countries and communities respond effectively. All this has been done in close cooperation with the rest of the UN's health, humanitarian, and socioeconomic responses, as has just been highlighted by Dr. Kanem. The pandemic has exposed fault lines and inequalities around the world, and have shown us how important it is to ensure that women and girls are given the choices and tools they need to build a better life. This is especially true for young people, and especially true for indigenous peoples, Afro-descendants, and people living with disabilities, all key constituents in UNFPA responses, but also living with specific vulnerabilities. UNFPA has also been drawing our attention to gender-based violence, an emergency within an emergency. UNFPA deserves credit for how it has helped to ensure continuity of services and support. And this is another area where we need to see a lot more collective action at all levels. UNFPA has been working with the UN Economic Commission for Africa on the African dashboard for tracking COVID-19 in real time, harnessing UNFPA work on data to provide relevant, accurate, and timely data on the pandemic on the continent. We commend UNFPA for its commitment to working within and beyond the UN to build on its collaborative advantages to deliver for women and girls everywhere. This includes delivering in humanitarian settings where the needs of women and girls are too easily overlooked. We note with appreciation UNFPA's management response to the evaluation of its capacity in humanitarian action and its commitment to prioritize the strengthening of UNFPA's humanitarian efforts. More broadly, we welcome the investment made in UNFPA's oversight functions and the commitment to being transparent. We also welcome UNFPA's continued emphasis on the prevention of sexual abuse, sexual harassment and abuse, and its firm stand on zero tolerance. We are pleased that UNFPA's resource situation is currently healthy and commend UNFPA for all its work in that regard. We are especially pleased with UNFPA's core resource situation which helps UNFPA plan ahead and allocate additional resources to program countries. We are concerned about the uncertainty that 2021 may bring and encourage UNFPA to continue with its innovative efforts to build partnerships. To help make UNFPA strong today and tomorrow, we encourage all member states that are in position to do so to support UNFPA's 150 donor campaign. As we heard during informals and structured funding dialogues more or less 2 weeks ago, some of the work that UNFPA is doing, including in my own country, Rwanda, on calculating the value for money on investing in areas such as voluntary family planning, is showing the wide-ranging benefits of achieving the 3 transformative results. Finally, we look forward to working closely with UNFPA to develop its next strategic plan, which we expect to further accelerate progress towards the 2030 agenda and the ICPD program of action. I cannot hand this statement on our behalf, Mr. President, without joining Dr. Kanem in really paying tribute to the frontline workers, midwives and all other frontline workers who have paid a high price to ensure that services to women and girls remain uninterrupted. Women continue to deliver during COVID. So there is no stop to pregnancies during COVID. And I really would like to pay tribute to those who have paid the high price, but to also those who have continue to serve all communities and countries, despite the knowledge that they sometimes put at risk their own families. Thank you very much.
I thank the distinguished permanent representative of Rwanda for her statement on behalf of the Bureau. Thank you, Ambassador. I now give the floor to the distinguished permanent representative of Sweden, Ambassador Hemström, speaking on behalf of a group of states. Ambassador, Excellency, you have the floor, please.
Thank you very much, Mr. President and Executive Director. Thank you so much for your statement. And of course, as part of the Bureau, full support for the statement just given by the permanent representative of Rwanda. I'm delivering this statement in response to agenda item 12 on UNFPA structured funding dialogue. To keep with the format of this session, I will deliver a short version of this joint statement and kindly ask UNFPA and delegations to please also take note of the full version uploaded on to Papersmart system. I'm delivering this statement on behalf of Australia, Austria, Belgium, Bosnia and Herzegovina, Bulgaria, Canada, Denmark, Finland, France, Germany, Iceland, Ireland, Italy, the Kingdom of the Netherlands, Luxembourg, Mexico, New Zealand, Norway, the Republic of Moldova, the Republic of Korea, the United Kingdom, Ukraine, Switzerland, and my own country, Sweden. The coronavirus sees no borders, and its effects on developing countries is projected to be immense. We cannot take the progress we've made so far for granted. We need to build back better and greener. The COVID-19 pandemic has emphasized the essential role of core funding, that core funding plays for the ability to quickly react and respond to unforeseen events. We welcome Dr. Khanam's emphasis on the importance of core resources and efforts already made to improve visibility and recognition of core funding, and call on further efforts in this regard, as member states underline their commitments of the funding compact. We further urge UNFPA to assess which outcomes of the strategic plan would be most impacted by COVID-19 and provide regular updates on the steps taken to mitigate those. We emphasize the need to maintain sustainable and predictable financing of UNFPA's strategic plan, including by expanding and diversifying the donor base. This is necessary to ensure long overdue universal access to sexual and reproductive health and rights, and the full and effective implementation of the Beijing Platform for Action and the Program of Action of the ICPD and the outcome of their review conferences. We thank UNFPA for the comprehensive reporting on funding compact implementation as part of the structured funding dialogue. Meeting the commitments of the funding compact is as relevant as ever, both by the member states as well as the United Nations Development System entities. In this regard, we would like to reiterate the importance of ensuring that country program documents are derived from the UN Sustainable Development Cooperation frameworks. Allow me to highlight a few reflections from our part. First, we welcome that 26% of UNFPA's non-core resources were channeled through interagency pooled funds in 2019. We are encouraged by this impressive figure and see this as a welcome trend towards less strictly earmarked financing. Second, we commend UNFPA for delivering 18% of its development expenditures through joint activities. Nevertheless, we also encourage UNFPA to engage in active dialogue with other entities of the UNDS, particularly the UN Development Coordination Office, to further improve the operational definition of the indicated development expenditures delivered through joint activities. We're interested in hearing how UNFPA plan to strive towards the harmonization of this and other indicators of funding compact implementation. Additionally, we are keen to know when a definition of joint activities will be agreed upon and operational across the UN agencies. Third, we welcome UNFPA's commitment to the global rollout plan of fully implementing the business operations strategy by the end of 2021. How do you plan to scale up support for these efforts, especially in the light of changing working patterns due to COVID-19? Lastly, I would like to extend our appreciation for the efforts UNFPA has undertaken in collaboration with UNDP, UN Women and UNICEF to improve the structured funding dialogues, strengthening the reporting on funding compact implementation, and engaging the respective executive boards on this matter. Further, we anticipate a forward-looking approach and an interactive dialogue that informs funding decisions and implementation of the strategic plan at an aggregated level, helping ensure that the budget is fully funded and that the allocations are aligned with priorities. I thank you so much.
I thank the distinguished permanent representative of Sweden for her statement. Thank you, Excellency. I will now give the floor to the Deputy Permanent Representative of Finland, who will make a statement for a group of states. You have the floor, please.
Thank you, Mr. President. I am delivering this statement on behalf of Australia, Austria, Belgium, Bosnia and Herzegovina, Bulgaria, Canada, Denmark, France, Germany, Iceland, Ireland, Italy, Japan, Kuwait, Luxembourg, Lithuania, Mexico, the Netherlands, New Zealand, Norway, Republic of Korea, Republic of Moldova, Sweden, Switzerland, Turkey, Ukraine, United Kingdom, United States of America, and my own country, Finland. Mr. President, COVID-19 is testing the limits of UN development system reform and emphasizing the imperative of implementing the reforms that have been put in place. Without these, we anticipate that the development system would not have been able to respond with the same degree of agility and coherence as shown over the past 6 months. For example, the coordination between the humanitarian and development system has enabled the agencies to be more responsive to the pressing needs of populations most immediately affected by COVID-19, whilst planning for the long-term recovery. We stress the importance of continuing this momentum. As the world continues to face the multiple consequences of COVID-19 and prepares to build back better and greener, we must ensure that the reform principles are at the core of the UN response. As member states, our commitment to reform is steadfast, and we know this is shared by the agencies and resident coordinators. In order to translate this commitment into reality, the actions of agencies and their representatives at all levels to follow through on reform commitments to ensure harmonized, efficient, and robust policy, programmatic and corporate approaches are critical. Allow me to highlight 5 key areas in which we would like to see further concerted action. First, coordination and collaboration. This is the bedrock of reform. Through policy mainstreaming, joint activities, and the leadership of resident coordinators, COVID-19 has put coordination to the test. The Global Humanitarian Response Plan, a UN framework for the immediate socio-economic response to COVID-19, and the Multi-Partner Trust Fund are positive examples of this in practice. Agencies must continue to pursue joint activities and collaborate, focusing on their respective strengths and comparative advantages at all levels. Furthermore, we underline the system-wide coordination role of the UN Women on gender equality and the empowerment of women. Second, efficiencies. We note the potential efficiencies that can be achieved through the implementation of the Business Innovation Group's research findings and its related work, and urge agencies to now demonstrate progress on this initiative. Third, the funding compact. This is a cornerstone of reform, and agencies must ensure that they have set comprehensive baselines, milestones, and targets for all relevant indicators, including where aggregated figures exist. The mutual responsibility of member states on the funding compact is also recognized. Fourth, UN Sustainable Development Cooperation frameworks. As member states, we reiterate the importance of ensuring country program documents are derived from UN Sustainable Development Cooperation frameworks, including through agencies' close work with the Development Coordination Office and resident coordinators. This also requires meaningful in-country consultation with member states of both the UN Sustainable Development Cooperation frameworks and CPDs prior to adoption of the country program documents. And fifth, the Management Accountability Framework. We expect full implementation of the Management Accountability Framework, including mutual performance appraisals, and would like to have regular updates from agencies and Development Coordination Office on the implementation progress. Mr. President, the reform process is not limited to the aforementioned initiative, and we call on agencies and the resident coordinators to take a holistic approach to delivering the SDGs. This includes ensuring agency alignment with the quadrennial comprehensive policy review, including on reform priorities such as efficiency and effectiveness, and thematic priorities such as inclusion of gender equality and empowerment of women and girls, and persons with disability, the peace, humanitarian development nexus, and climate and environment. As we move forward into the development of new strategic plans for 2022-2025, we encourage agencies to apply this approach and engage closely with the Executive Board with sufficient time for consultation as the development of strategic plans and result frameworks progresses. Additionally, agencies must ensure efficient humanitarian competency and resources as respectively appropriate. As the resident coordinator's role takes in an increased range of humanitarian activities due to COVID-19, the importance of humanitarian competencies, including international humanitarian law and humanitarian access negotiation, is highlighted, as well as the need to strengthen humanitarian capacities and integration with development programming in the field, particularly in agencies with mandates such as UNFPA. As we look to the year ahead and a green, inclusive, and resilient recovery, building back better and greener is a chance to continue to implement the reform processes and ensure the recovery continues to be supported through strengthened coordination across the funds and programs and wider UN development system. Thank you.
Thank you. Thank you very much, Excellency. And I'll also ask that members try to keep their statements shorter so that we can get everybody in within the workable time. I thank all of you who adhere to this. We will now give the floor to the distinguished permanent representative of Colombia. Excellency, you have the floor, please.
Thank you, Mr. President, Madam Director, Executive Secretary, members of the Executive Board. Dr. Natalia Kanem, thank you very much for your report. It's been a very comprehensive and very useful presentation. Today, I would like to start recognizing the role of the United Nations Population Fund in Colombia and its valuable support in the coordination of our national response to the pandemic, especially in relation to the attention to our host communities and the 1 million Venezuelans migrants that we have received. This global and local response to the threat of COVID-19 has been facilitated due to the implementation of the reform of the United Nations development system. There is no doubt that the reform has set the basis of a significant process of renewing the relation of the agencies, funds, and programs with the states by the strengthening the interagency work and reducing the duplication of efforts and the atomization of cooperation. In Colombia, the United Nations Population Fund is having a very positive impact in close coordination with the Minister of Health and with local officials. It is supporting the delivery of contraceptive methods, prenatal care, safe delivery and care, among others. Also, it has also done a very good job in the prevention of gender-based violence, mainly in the field of psychosocial health and delivering safe spaces for the survivors of this scourge. In this context, and in line with the discussions held during these days, my government would like to express its concern for the current trend of the reduction of core resources in the general budget of the fund. This reduces its capacity to address ordinary operations and to tackle unforeseen challenges around the world. Therefore, we value the importance of seeking and implementing innovative forms of financing, as well as the efforts to mitigate the risk represented by the dependence of traditional financial sources. In the field of evaluation, my government would like to underline the call to improve the coordination with the humanitarian teams at the country level. This will allow us to couple the processes of in the identification needs and the definitions of mechanisms for measuring the contribution of each agency. In addition, Colombia highlights the importance of independent evaluation as impartial diagnostic mechanisms of the efficiency, effectiveness, and sustainability and intervention in the field. To conclude, Colombia reiterates its support to the United Nations Population Funds and looks forward to the adoption of our new CPD that will focus the future work on the fields of peace with legality, migratory challenges, and catalytic SDGs. Thank you very much.
I thank the distinguished permanent representative of Colombia. I will now give the floor to the distinguished delegate of Germany. You have the floor, please, Germany. Germany. It would seem that we are having a challenge with our German delegate. I will come back to you in the interest of time. Are you available? I will then.
He is unmuted, Ambassador Webson. I'm not sure if there's a technical issue on his side.
Can you hear me, Germany? Okay, so we'll come back to Germany and we will give the floor to the distinguished permanent representative of Denmark. You have the floor, please, Denmark.
Okay, can you hear me?
Yes, I can hear you.
Yeah, we need to get permission from the host to unmute my screen. Thank you, Mr. President. Thank you, Aubrey, for giving me the floor. Let me begin by giving a very, very warm welcome to Ms. Keita and Mr. Peterson, Diane and Ib. It's great to see you here. It's great to have such a strong senior management team in place in UNFPA. And then, Madam Executive Director, I take this opportunity just to highlight sort of a few key Danish priorities. First, on humanitarian action. I think there is an evident need for a strong UNFPA in the humanitarian field, and we, Denmark, therefore welcome very much the evaluation of UNFPA's humanitarian capacity. And we commend you for the significant improvement in UNFPA's humanitarian action, but also note that there is continues to be room for improvement, and urge you, as I know you will, to address the weaknesses. And in that regard, be very interested to hear your reflection on which of the recommendations of the evaluation you will prioritize in the short to medium term, and the reasons behind it. Now, second, on COVID-19 and the funding situation, some of my colleagues have touched upon also. Now, I think while the COVID-19 crisis is, of course, unprecedented in so many ways, it does share one similarity with previous crises, and that is that women and girls tend to suffer the most. And so for Denmark, it has been a key priority to support UNFPA's COVID-19 response. We therefore paid our annual core contribution in full in the first quarter of 2020, and also found extra funds resulting in a total contribution in 2020 of more than $67 million to date. And we note the cautious optimism for 2020, but also that more uncertainty lies ahead. And I share Valentin's concern for 2021 and call on all supporters of UNFPA's mandate, with the means to do so, to maintain the level of their contributions to UNFPA and increase it if at all possible. It's clear that the COVID-19 pandemic entails unprecedented risk, but it might also actually present us with opportunities to rethink the way we do things and potentially serve as a disruptive for social change. And Natalia, against that background, where do you see potential for UNFPA to use, if you like, the COVID-19 crisis to disrupt business as usual for the better and rethink all ways of working? And then finally, Madam Executive, you yourself mentioned the Beijing +25 process and the follow-up to the Nairobi summit as important for accelerating process in this decade of action. In that regard, Denmark looks forward to working together with you and your team, with the entire UNFPA, in the Beijing +25 Action Coalition on bodily autonomy and sexual and reproductive health and rights. As we look forward to continue our cooperation to ensure that the commitments made at the Nairobi summit are turned into concrete action. And we have, as you know, also provided financial support for the establishment of the high-level commission on the Nairobi summit, ICPD 25 4. As always, I want to close by thanking UNFPA for our strong cooperation to make real changes in the real lives of real women and girls, and then not least to thank UNFPA staff in the field. Thank you, Mr. President.
I thank the distinguished permanent representative of Denmark for his statement. Is our colleague from Germany available to speak now? The delegate of Germany? It would appear that we are still having some problems with our friends from Germany. Sam, do you have any indication what's going on?
No, maybe I'm not sure if the German chargé d'affaires, if his computer's volume is down, maybe that's one option. I saw at one point his microphone was picking up noise from his side. So maybe if he's able to check the volume on his computer, but he is unmuted, so he should be able to speak.
Okay, I will, if you can communicate with him, if he or he can communicate with you, we can come back, but I will go to the podium and ask Dr. Cannon to respond to the state questions and or statements. And of course, Dr. Cannon, you can invite your colleagues on the stage with you to make any remarks if you wish. So Dr. Cannon, please.
Thank you so much, Mr. President, and thanks to all who have spoken so far. I will try to be crisp and brief, but there are a lot of very exciting ideas coming forward. And as the needs are greater, we really are in dire need of taking the best practices and putting them into action. I would like to thank Ambassador Valentin, speaking on behalf of the Bureau and partly on behalf of Rwanda, for the constant support and the strategic advice that we have derived from the Bureau. There have been moments where you've made yourselves available at all hours to discuss with me a way forward, and this has been very much appreciated. Substantively, on some of the issues raised by Rwanda and Sweden, on broadening the donor base to begin with, we've been in a position where we've been able to reliably count on the consistent generosity of some of the traditional donors to UNFPA. But we want to continually seek to broaden that donor base, especially among non-OECD DAC emerging donors and program countries. Diversifying the donor base and having the investment expectations shared among a broader group is also central to lowering the financial risk for UNFPA programming. However, we do need many more member states to commit to core funding. We would like to reach our 150 core donor target. To date, we have just shy of 70, we have 69 who have made official contribution commitments to core resources. And last year we had 106 who provided. So it's a stretch to 150, but I continue to make the calls and make the case for why UNFPA is really worthy of such support. I would also note positively that as mandated by our structured funding dialogues last year, the quality of funding has increased, with 64% of funding being either core or thematic, other less earmarked modalities. Moreover, the interorganizational transfers grew by 60%, from 164 million to 263 million. So we're going to keep at this. We're going to keep raising awareness among member states and potential new donors through our regular dialogues with the board, which you've kindly allowed us to schedule throughout the course of the year, including within regional groupings. We want to give visibility and to advocate for funding for UNFPA funding instruments like our thematic funds, and to target donors based on what they're interested in and how we see the overlap of priorities. We're launching our annual resource mobilization campaign this year, including regular reminders via the United Nations missions and direct outreach to capitals through our country teams and our regional offices. And here we're elaborating papers, we're providing argumentation, we're trying to analyze trends and to use our armature of data to show how we're making a difference, or conversely, where the gaps are huge and we need help. I've also been pleased to see that we've been able to communicate better. I hope the video gave you a flavor of how we're trying to appeal, not just to donors, but also to the people who are in need of services and to young people to kind of use their disruptive ability and talent and imagination to help us. The resource mobilization efforts have to be matched with results, as I said earlier. And I think here the private sector giving through foundations, through companies, has been successful, along with our push for individual giving to increase. I'd also like just to address briefly what Sweden and others put on the table regarding the COVID-19 impact upon UNFPA and how are we addressing and mitigating this. Strategically, we have upped the ante on our monitoring of impact on our implementation of the current strategic plan. We've adapted. We've tried to ensure that the impacts and responses are reflected in the development of the next strategic plan, which, as you well know, will start 2022 through 2025. And we are continuing to monitor and to build funding and strategic partnerships. That's had some new interest because of our deployment of immediate help in the COVID era. And of course, as was already mentioned, we've deepened collaboration, and some of the agencies mentioned, UN Women, UNDP, the Office of the Commissioner on Human Rights, etc. All of these are strategic collaborations in terms of our aims. The jointness, the DCO, Sweden asked whether or not we actually have a date to move ahead with this. Just before our meeting now, I was in a session chaired by our Deputy Secretary General on the reforms, bringing together the Sustainable Development Group agencies. And to the best of our knowledge, DCO hasn't given a date for a consolidated definition. However, we're keen to support this to happen as soon as possible. And as you saw in our structured funding dialogue, this is agreed language that we've really been happy to see. Now, for issues put on the table by Finland, in terms of the coordination and collaboration of UN reforms, our response has clearly shown the benefits of that enhanced coordination and collaboration. We believe that this coherence on the part of UN entities has allowed us to work with an empowered RC, and we've seen that the RCs indeed are taking up that mantle. So the joined up responses on the health, humanitarian, and socioeconomic fronts have been very, very valuable to us. And our Ambassador Colombia also put that on the table. For the MAF, the framework, we're continually assessing the progress in the implementation of the MAF at the country level, and including through the survey. The findings from the survey are showing that our country offices view work with the resident coordinators as enablers of our mandates. This is something that's really important to us. We don't want women and girls issues or sometimes discomfort discussing the intimacy of sex or of violence to shove women and girls aside. And we are seeing that the EOSG, the Secretary General's unit, DCO, as well as the entire UN Sustainable Development Group, regionally, globally, that we are working together in this recent ECOSOC resolution on the remaining mandates on the UNDS reform. And the mainstreaming and even prioritizing of gender in the development humanitarian nexus is beneficial to the work that everyone is doing as we try to build back better and greener. Women are the guardians of a lot of the issues that the land and climate and et cetera represents. So here we stress the importance of empowering women and girls as leaders and as change makers for sustainable development, building on what we saw in Nairobi and throughout the road to ICPD 25. And now with the Beijing platform this year, the reproductive health and reproductive rights agenda is vulnerable always, but we need to bring data and reason to the table in making the case for never excluding women and girls who tend to be the most vulnerable and the most excluded. Hunger, for example, is a constant companion to women and girls, and now with COVID worsening, yet families will tend to prioritize the feeding of men and boys first. Hence our Commission on Population and Development and the debate on how sexual and reproductive health affects that potential mom and also newborns. If you miss that nutritional moment for the young brain to develop in utero and in the first days of a newborn's life, how are you going to recover and et cetera? So I think this building back better and greener dialogue is very important. Recently, I participated in a dialogue hosted between the Nordic countries and African Union regarding the development cooperation. And it was very exciting to see some of the new ideas bubbling up there. Services have to continue. That's been our bottom line. It's been hard to pull all those pieces together, but we have. It's been a logistical nightmare in so many places, but we really have tried our best to make sure that women and girls will not suffer and that they will be safe from harm. So I'll just make a couple of other remarks regarding issues put on the table by Denmark on our humanitarian principles and why it is that UNFPA was very happy to see this evaluation, which is now giving us guideposts as we try to make that work stronger and better. Now, we've tried to be proactive. We do operate in the protection sphere. Gender-based violence has become a trademark for us, and we're under the umbrella of the Refugee Agency. In particular, our teams on the ground are working to strengthen operations. This means in particular preparedness and pre-positioning. And between hurricane and cyclone and conflict and everything else, this has been a challenge, but supplies is very, very fundamentally critical. Our humanitarian teams are also using their expertise for data collection, for reporting, for human resource capacity, and these steps all help to further ensure that we move forward as an effective whole of organization response, backing up our humanitarian program in times of crisis. We plan to implement a comprehensive corporate approach on preparedness for supplies in line with the recommendation. The corporate decision on stockpiling key humanitarian supplies and guidance on national preparedness and pre-positioning is something that the board has emphasized. And for us, we will also be developing new trainings on humanitarian supplies and trying to help with revision of minimum preparedness actions. I mentioned we're updating our procedures. Fast track procedures are among these. And the delegation of authority There's so many things that we're trying to do in advance. So when crisis hits, we're ready. I would like to appreciate very sincerely the words of acknowledgement of the results that UNFPA has been able to achieve on the ground so far. And to also underscore that I've certainly heard the need to continue to push forward and to do better in concert with others. I'd like to answer the question about potential disruptors. Women-led organizations and youth-led organizations across the spectrum, and I've seen this in our Africa work, in our Latin America and Caribbean countries, the Arab states, Eastern Europe, Central Asia, and in Asia Pacific. Women-led organizations and youth-led organizations are part of my secret sauce, if you will, my idea for how UNFPA can really harness partnerships that we have had over time and share some of our expertise, but also funding with them at a time when they are meeting critical shortages. And so I think our teams on the ground have been very, very skillful in harnessing that energy, but also it's very practical because these are people right at the face of where the work needs to happen. So I would like to turn to our new deputies to add their word to what I've been able to discuss here. And if I could turn to Jenna Keita first, just to have your early, yes?
If we could keep the responses a little shorter because we have a lot of comments.
Oh, we do.
Statements.
Certainly, Mr. President. Thank you.
Thank you.
Over to you, Jenna, please, just briefly, and then Ib.
Mr. President, Excellencies, distingués membres du Conseil exécutif, I'm very honored to take the floor here today. And very, very briefly, I would like to add to what Dr. Kanema said, how important it is to be working to the last mile and to reach the population at the very, very end. And for that, we would like to really thank all our donors and member state countries and all our support to get there. I would like, during this COVID pandemic, it has exposed fragility and exacerbated inequality among populations. So I look forward to working really, really closely under the leadership of Dr. Kanem and my twin brother, the Deputy Executive Director Management, to ensure that our mandate and our actions are translated to better the lives for women and girls around the world. Thank you so very much.
Thank you, Natalia, and thank you, Mr. President, in particular also for your warm words of welcome. It's really a pleasure to be here, and I really look forward to working with you again, Watson, and thanks to everybody else who have provided such a warm welcome. This is very much kind of a dream job to take up. I do it very excited, but also very humble. UNFPA has a fantastic and very relevant and very needed mandate in ensuring the rights of women and girls, in particular sexual and reproductive health and rights. And we know there's a big need out there. We also know that things are possible. We saw it last year in Nairobi. A lot of commitments, a lot of stories about what has actually been achieved. So this is possible, and I look forward to join everybody else in working for the strategic plan and to reach the ICPD agenda and the SDGs. Just to follow up, of course, not much to say after the very eloquent and good points made by Dr. Kanem, but on the UN reform, I think those who know me already will know that this is an area that I have spent a lot of time on and is very dedicated to. So just to assure you that I definitely will work. And I thought there were many good points raised also from Finland on behalf of this group of countries. I think also we can say that UNFPA, and I can say it because I just joined, is definitely one of the pioneers. Actually, we are at shared locations in 72 shared UNF premises are shared with other agencies in 72% of where we are present. So I think that's just a testimony also to that. In addition to what Dr. Khanum mentioned on the MAF and on the joint programming, just on joint programming, I think it's also worth to remember, and I think we had that in previous discussions, that to be working very coordinated and complementing each other doesn't mean always that you need to have a joint program, because you can have programs that really support each other. So that has to be part of the equation as well. But of course, joint programming is so important in that. And just at the last point, just to mention also our dedication in UNFPA. UNFPA has, together with UNICEF, been appointed to co-chair the UN Sustainable Development Group's new task team on business operations, which will look into the efficiency agenda and the business operations and country offices. And I feel very privileged that I will take up that task as being co-chair with a colleague from UNICEF in that work in the coming months. So we will also there work with the issues raised by Finland and others in the debate. Thanks a lot.
Thank you very much, Dr. Cannon, Janiat, and I look forward to the continued work and collaboration with all of you. So we will now move back to statements and or comments and questions, and we'll try again with our colleague from Germany. Is the delegate from Germany now ready and available?
Ambassador Webson, if the Chargé d'Affaires is unable to make the statement, another delegate from another colleague from the German delegation will make the statement. So I'm not sure if that's the minister or Annalena, but if one of them maybe wishes to take the floor at this point, they could read out that statement, if that's okay with you, Ambassador.
Yeah, anyone. I mean, I didn't indicate exactly who it was, so it doesn't matter. Is anyone, any member of the German team or contingent? Okay, so we may come back again to the colleagues from Germany, and when we sort whatever is the problem at this time, and we'll go to the permanent representative of the Gambia. Gambia, you have the floor, Excellency.
Thank you very much, Mr. President, for once again giving me the floor. Once again, I seize the opportunity to thank you for your able leadership and to assure you of my delegation's continuous support. I also associate my delegation with the statement delivered by Ambassador Valentin on behalf of the Bureau. Mr. President, the Gambian delegation would like to thank the Executive Director of UNFPA for her excellent and informative report. I want to also place on record that UNFPA in the last few years have become one of Gambia government's strong partners in matters dealing with women and girls in the Gambia. The interventions from UNFPA programs continue to positively impact lives in the country. This is a partnership that we continue to cherish and appreciate. The Gambia recognizes the valuable contributions of UNFPA in our drive for protection and advancement of women and girls. In this regard, the government has created the right environment to further facilitate and improve our engagements. Hence, the Gambia would like to encourage UNFPA to further expand its activities and support to the government to help us advance the protection of women and girls, especially within the context of COVID-19. The emergence of COVID-19 underscores the urgency and need for the two to scale up the excellent partnership to assist in delivering on key objectives and outcomes relating to UNFPA's mandate. For the record, as a key humanitarian actor, UNFPA's assistance to the government in the COVID-19 response in the socio-economic area is highly appreciated. The government of the Gambia have been working with UNFPA on strategic priority areas relating to women and girls, and with the setting up of a special ministry for women, children, and social welfare in January 2019, our expectation and strong desire is for UNFPA and the government to scale up their cooperation and partnership. Mr. President, the government of the Gambia is committed to continue advancing policy measures geared towards protecting and promoting the welfare of women and children, especially the fight against women and children trafficking, gender-based violence, just to name a few. The Gambia today is a democratic state with the enabling environment for UN agencies, CSOs, NGOs, and other right-based organizations to freely operate and implement their mandates and activities. In this regard, I would like to gently remind the Executive Board and Madam Executive Director that in the absence of UN Women, UNFPA remains the main UN agency in the Gambia dealing with women issues. The value addition from the organization to our efforts in matters concerning the protection and welfare of women and girls remains sacrosanct. Within this context, I will conclude by appealing strongly to the Executive Board and the Executive Director of UNFPA to do everything possible to ensure that UNFPA continue to be represented in the Gambia at the highest possible level. This will facilitate speedy program implementation, further enhancement and expansion of our partnership, and achieving more and better for women and girls in the Gambia. We have the strong conviction that as a country in transition with democratic structures, this is the time for all UN agencies, especially UNFPA, to continue providing more support and maintain its country's representation at the current level. Anything to the contrary would adversely affect program implementation and most probably reverse the gains made over the years. My government, therefore, is urging the Executive Board and the Executive Director of UNFPA to favorably consider this solemn appeal being made in the best interest of our partnership, especially as it relates to women and girls issues in the Gambia. Mr. President, Madam Executive Director, this is the time to scale up our engagements and partnership. On that note, I join others to welcome Madam Keita and Mr. Peterson to the UNFPA family. Thank you.
I thank the distinguished permanent representative of the Gambia for his statement. And may I try again with Germany?
Yes,
Yes,
Ambassador. Oh, please go ahead.
Yes, Karin Göbel from Germany. Thank you. If you can hear me,
yes.
Thank you, Dr. Kanem and colleagues from UNFPA for this update and for the valuable insights into the important work of UNFPA. Less than a year ago in Nairobi, we reaffirmed our common commitment to the Cairo Program of Action. Now, just a few months later, the relevance of UNFPA's work and the need for accelerated action has become even more urgent. It is indeed a fact we cannot ignore. The COVID-19 pandemic worsens the inequalities women and girls were already facing prior to the outbreak. In this dire situation, Germany remains firmly committed to multilateral cooperation. We are aware that a strong and responsive UN system needs reliable funding, most importantly, core funding, so that it can carry out its task effectively. This is why, in support of UNFPA's Global Response Plan, we have increased our contribution to UNFPA's core funding by 30 million euros, bringing it up to 70 million euros in 2020. We understand that UNFPA, just like other agencies and development actors, is looking into an uncertain future regarding the prediction of ODA flows. We would appreciate more information on how possible decrease of funding would impact the meaningful follow-up to the 12 global commitments in the Nairobi statement and how UNFPA would respond to this. Thank you very much.
I thank the distinguished delegate of Germany. And I now give the floor to the distinguished delegate of China. China, you have the floor, please.
Okay.
The distinguished delegate of China.
Yeah.
Yes,
Okay.
please.
Thank you,
I can
Mr.
hear you.
President. Yeah, Excellencies, colleagues. Thank you, Mr. President, for your strong leadership, and thank the Secretariat for the collective efforts in organizing this second regular session. Also thank Dr. Kanem for your comprehensive report. We highly appreciate UNFPA team for their courage and efforts in fulfill the UNFPA mandate and strive for 3 zeros despite of the current difficulties brought by the pandemic. And also most warmly welcome to the Deputy Executive Director, Mr. Peterson. Welcome back to New York. This year marks the 75th anniversary of the United Nations. At present, the COVID-19 pandemic continues to spread. Our world is facing multifaceted and complex challenges. We need to uphold multilateralism, fully demonstrate the spirit of solidarity and cooperation, work together to support UN development agencies in order to address the most urgent needs of developing countries in epidemic response, economic and social recovery, and sustainable development. UNFPA has a long-standing commitment and contribution to helping vulnerable groups such as women, girls, pregnant women, elderly, and adolescents, providing reproductive health services in the most vulnerable countries and regions, promoting gender equality and women's empowerment. Their work is indispensable, is especially true under current circumstances. So we hope that the international community will continue enhance its support to UNFPA, translate their commitment into action, especially provide UNFPA with stable, adequate, and predictable co-resources contributions. In terms of UNFPA's work, we support UNFPA to continue to focus on the impact of the epidemic on the rights and health of women and girls, to provide professional guidance and support to program countries during the response and the recovery process. And we also encourage UNFPA to strengthen the funding planning, continue to focus on key areas in the strategic plan and CPDs, improve the effectiveness of resident work, strive for leave no one behind. Mr. President, China has always been a firm supporter of multilateralism and UN. We look forward to deepening our cooperation with UNFPA together to address new difficulties and challenges in the population development area inside China. And we'd also like to cooperate with UNFPA through South-South and Triangular cooperation, jointly contribute to support other developing countries in their implementation of the ICPD Program of Action and the Sustainable Development Goals. Thank you very much, Mr. President.
I thank the distinguished delegate of China for her statement, and I give the floor to the distinguished delegate of Mexico. Mexico, you have the floor, please.
Thank you, Mr. President, and thank you, Dr. Kanem, for your very complete presentation and the update on the progress of the next strategic plan and all the other relevant topics that you mentioned, in particular, the impact of and response to the COVID-19 and how this will affect the work of the fund on the ground. We are deeply concerned that the impact of COVID-19 on access to sexual and reproductive health and rights is alarming. And when it comes to conflict-affected areas, this access should be recognized as an essential humanitarian service. Confinement measures have increased the risk of gender-based violence and harmful practices around the world, affecting disproportionately the most marginalized groups. So the active engagement of women and girls in all their diversity in the COVID-19 response and decision-making process must be ensured. We stand by UNFPA on the comprehensive COVID-19 response that has been undertaken. We remain fully committed to accelerating progress on ICPD program of action in this decade of action, as well as the follow-up to the Nairobi Summit. We also commend the active participation of UNFPA in leading the Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights in the Generation Equality Forum. As the COVID-19 pandemic continues to evolve, in line with Resolution 72/279, we encourage UNFPA to continue coordinating its efforts at the country, regional, and global levels in support of prevention, response, and early recovery, working with governments, other UN agencies, civil society organizations, private partners, as well as with affected groups such as frontline health workers, young people, and older persons. We recognize UNFPA's commitment to support countries' needs and protect and uphold the rights of women, girls, young people, and other marginalized and vulnerable groups. It is time to transform words and commitments into bold, decisive, and sustainable actions. Finally, we would like to ask, what is UNFPA doing to ensure the meaningful participation of young and old women from marginalized groups in the global response to COVID-19? Thank you very much, Mr. President.
I thank the distinguished delegate of Mexico for her statement, and I give the floor to the distinguished delegate of Korea. Korea, you have the floor, please.
Thank you, Mr. President. First of all, my delegation would like to align itself with the joint statements delivered by Sweden and Finland. We would also like to express our appreciation to the Executive Director and UNFPA staff for their tireless efforts during this difficult time. The COVID-19 pandemic has been threatening to thwart our efforts to achieve the 3 transformative results by 2030. In particular, gender-based violence has risen at a faster rate than any other consequences of the pandemic. My delegation believes that UNFPA's normative and operational role is even more important in the COVID-19 era and beyond. As a steadfast supporter of GBV response aligned with its Action with Women and Peace initiative, Korea has closely partnered with UNFPA to provide GBV assistance in fragile settings. We value UNFPA's holistic approach that encompasses psychosocial and legal support, as well as awareness raising and services for GBV survivors. Given the grave need to address GBV, we encourage UNFPA to continue to mainstream GBV into COVID-19 response and recovery efforts. As for humanitarian activities, Korea welcomes overall progress to strengthen UNFPA's humanitarian capacities. In line with the recommendations based on the evaluation results, UNFPA should continue to translate its global commitments into tangible actions at country levels. At the same time, UNFPA's activities should be geared towards sustained results for the beneficiaries, and their feedback needs to be incorporated into the programming cycle. Korea has continued to contribute multi-year and flexible humanitarian funding to UNFPA this year, and will continue to do our part to help accelerate the progress on the 2030 agenda and the ICPD program of action. Thank you, Mr. President.
I thank the distinguished delegate of Korea for his statement, and I will give the floor to the distinguished delegate of the European Union. You have the floor, please.
Thank you. Hold on. Thank you, Mr.
Yes,
President.
we can hear you.
Yes, you cannot hear me?
We can hear you. Yes, please.
Okay. Thank you, Mr. President, for giving me the floor. Speaking for the European Union as a donor, I refer to the written statement we have posted on the Executive Board website. I would like to thank Dr. Kanem for her, as always, inspiring and informative update on the work of UNFPA. And I have some small comment and a question. UNFPA is an important partner, both on advocacy and implementation for the European Union in the fight against gender-based violence and in the fight for sexual and reproductive health and rights, especially in the difficult times of COVID-19, the challenge of our lifetime. Where we work together, we make a difference. On gender-based violence, we are pleased that the flexibility in the Spotlight funds, an EU investment of €500 million in the historic push to end gender-based violence, has helped the rapid response of UNFPA, as well as UNDP, UNICEF, and UN Women to COVID-19. On sexual and reproductive health services, the European Union contributes with 78 million to the UNFPA, 78 million euros to the UNFPA Supplies Fund, including improving access to family planning in 76 mainly low-income countries. We commend UNFPA's role in the concerted action to prevent disruption of contraceptives during the COVID pandemic. Could you give an update on where we, if we are succeeding in this, and in these difficult circumstances, are we making progress? Are we succeeding in securing contraceptive access continued during COVID? And also, we would like to invite a highlight on the support to national health systems during COVID emergencies. Dr. Khanam, we know you will keep up the fight for UNFPA's three transformative goals during COVID and beyond. Thank you very much.
I thank the distinguished delegate of the European Union, and I will give the floor to the distinguished delegate of the Russian Federation. Russia, you have the floor, please.
Thank you very much, Mr. President, and we thank Madam Executive Director for her detailed and illustrative report today, and also for elaborating on UNFPA's work during COVID, especially by providing some specific examples on procurement and on helping women to access reproductive health services during the times of the crisis. So thank you for the report. We would also like to commend UNFPA for being able to surpass the expected level of core resources in 2019. And would like to ask one question. So since 2020 is the year of censuses in many countries, we would like to ask how UNFPA worked with governments on that, taking into account these challenging times. So was the decision to move censuses online or to switch them to the next years? So could you please elaborate on that? And yes, in conclusion, I would like to say that we value our cooperation with UNFPA on mutually beneficial terms, and we remain a strong supporter of the ICPD program of action. Thank you.
I thank the distinguished delegate of the Russian Federation, and I would like now, Excellencies, colleagues, members of the board, I would like to return to Dr. Cannon and her team for responses to the several statements and or questions asked. Dr. Cannon, please.
Thank you so much, Mr. President, and thank you to all the delegations who have expressed their views. As a quick backdrop, I would like to emphasize that in countries, our UNFPA country programs are framed around national priorities. They're developed in collaboration with governments, and depending on the country context, we strive to make sure that now with COVID-19 and the preparedness, response, and recovery that implies, that we issue our operational and our programmatic guidance accordingly. Regional offices have also been in the forefront of our COVID response, our repurposing, our reprioritization. So it was heartening to hear from Gambia and Mexico and others the reaffirmed support to what it is that we're delivering on the ground. In the instance of the recognition that choices always have to be made, we aim to nest our choices vis-a-vis what it is that governments are prioritizing. In Gambia specifically, Your Excellency, just to reaffirm the support of UNFPA to urgently addressing the COVID pandemic and also the commitments that were made along the road to Nairobi. It was a pleasure for me to personally be present in Gambia, along with our regional director and his team, to see how we've highlighted gender-based violence, for example, and other harmful practices, child marriage, et cetera, that government is determined to change, and the encouragement of women's empowerment in the ministries. We are indeed an active member of the United Nations country team and working closely with the other agencies there present to be sure that the UN development system as a whole advances the vision of the government of Gambia and the aspirations of the women and girls of the country. On our presence, I would note that our commitment is indeed to increase investments in programmatic delivery in the West and Central African region overall, which was also approved by the Executive Board as part of the midterm review in June 2020. Over 50% of UNFPA resources are prioritized in Africa according to need. And out of our $310 million resources allocated to all regions, 22% is allocated to the West and Central Africa region, where there are so many complex issues that are barriers to women and girls being able to fulfill their potential. For complex programs to continue to achieve greater results, it is imperative to review a staffing structure, and the key objectives of that exercise is to have management structures that will enable UNFPA to effectively fulfill our technical assistance, our guidance, our policy development and advocacy role that is aligned with national priorities in the region. We have adopted a phased approach, and we are undertaking an analysis of positions right now in all country offices, and every case will be discussed in close consultation with our regional and country offices and keeping lines of communication open with our government partners indeed. So I would like to reassure the ambassador that UNFPA is committed to continuing to work closely with government to address the SRHR issues of women and girls and the empowerment of young people and so many other things, and to help ensure the highest representation possible. Now turning to comments by Germany, thank you so much. We welcomed very much those strategic increased contributions to UNFPA. That core funding, as I alerted the Executive Board in my original remarks, spelled all the difference from us to be able to go out there and take charge of programming in a bigger way. So much appreciated. Similarly for European Union, the ability to have a partnership that's a thought partnership, a funding partnership, but also takes into consideration the needs on the ground and the alignment of the country cooperation frameworks has really been literally a lifesaver. Now, we were asked a few questions. I'd just like to briefly respond how we analyze as we speak the potential impact of the funding decline, which is predicted because of the economic shakiness in the world right now on our agenda. We are spearheading an analysis, and we'll keep the board posted at regular intervals as to how that impact is affecting our programs as more on that comes in. As I will cover two more short points, I can also offer a bit of an expansion on that. Arthur Erkin, who oversees our funding prospects work, is available to address the board, Mr. President, if that would be helpful. So I'll just quickly turn to comments by China and to agree fully that UNFPA must keep our focus on the agreed strategic priorities. You've called on us to closely monitor the COVID impact and to prioritize the data analytics, which is a strength of UNFPA in scenario building. That's foundational to leaving no one behind. We need to know where people are and their progress along that axis of vulnerability. So our provision of technical briefs are working with other agencies such as DESA, regional groups such as the Economic Commission on Africa and ECLAC in Latin America, very important. And these mandate areas depend on implementing partners and the cooperation and training. Mexico had raised the very important issue of the vulnerability of women and girls, focusing on young women and older women during the COVID pandemic, which is a central focus of our response in ensuring that they're not left behind. We've convened in countries, but also globally to call attention to these two sides of the coin. And the explosion in gender-based violence up to and including femicide is something that the Secretary General has called on all of us now to address in concert in a very serious way. And we, of course, are front and center and working very closely with all other actors in the UN and outside to see what can we really do now to call attention to women's rights, that no one deserves to be physically abused, sexually abused, and that the psychosocial counseling needs, which Korea and others refer to, are urgently needed. This is how we prevent trauma from harming people over a lifetime. Now, the EU has asked very important questions about the system reforms and made comments regarding how we can continue to update access issues as well as the national health system support that we provide. Just again, very briefly, and we can return to expand if there's time. Our country representatives are working through and as part of the country teams and humanitarian teams when that applies. And we've actively engaged and led the critical pillars of health, social protection, and vulnerable groups. The logistics nightmare that COVID has brought on for delivery, not only of contraceptive supplies, but also essential drugs during pregnancy and supplies like PPEs for our midwives, has really tested our mettle. And at this point, the experiences and the lessons that we're learning and the support of other arms of the United Nations, WFP, UNICEF, of course, UNHCR, we come under the umbrella, has been very important for us to succeed. That said, we are very much worried all the time about the supplies network. In collaboration with the Geographic Information System company, ESRI, we've developed a population vulnerability dashboard. This has been offered to the wider system and appreciated because it helps governments and policymakers, public health people, make real-time decisions with access to population data, showing the spatial relationships of who's vulnerable, where they are, and to inform preparedness and response. And then lastly, on census, I would like to emphasize that these enumerations are ongoing, but many of them have been postponed. Where we could, we've encouraged countries to move online if the technical preparation is available. Where not, we have been very much part of keeping the momentum going, and the technical ability of our technical advisors is being planned for when operations resume, movement can continue because of lockdowns, and to keep those budget lines to support operations next year. This has actually been, I think, a point of good mobilization and cooperation because countries need and want updated census information. And we've had some very valuable sessions on alternate paths in terms of the methodology of census going forward. And we're sharing this guidance to governments so that even while doing the enumeration and knocking on the doors, et cetera, we can have personal protective equipment, PPE, and social distancing strategies for the people pursuing the questionnaires to go forward. I'm not sure if other hands are raised, Mr. President. I can't actually see. So let me just offer Arthur Erkin's availability to speak more to the challenges of the funding situation, and also to thank all partners. Korea mentioned our collaboration on GBV. The European Union Spotlight has been another very, very important vehicle. Ourselves, UN Women, others are really availing women and girls' ability to get shelter, to be able to report, to be able to understand that, you know, their inherent human dignity isn't suspended because of a viral pandemic. Thank you, Mr. President, and I'm happy to expand more. I'm just trying to keep to brevity. Thank you.
Thank you, Dr. Cannon. Were you going to invite somebody to speak on the funding?
Thank you so much, Mr. President. Arthur Erkin, our Director for Resource Mobilization and Communications is on the line. Arthur, can you just briefly speak to some of the points raised by the Executive Board?
Sure. Thank you, Natalia. And Mr. President, distinguished members of the Executive Board, also in the interest of time, I will say a little bit briefly about the fact that we, of course, are monitoring the economic situation very carefully, almost 24/7, because we know it has an impact in the end on ODA. As we speak, we have started our own analysis of the trends that we foresee for 2021 and beyond. We are talking directly with OECD DAC, also in Paris, as to what they see, as well as the World Bank. And that will then inform our own opinions, of course, on where we think, first of all, the impact of economic downturn on ODA, and of course, as well as what that could mean for UNFPA, and then inform the organization internally, of course, on the impact that it could have on our program next year, and of course, on the development of the next strategic plan. I will say this, that we are, of course, reaching out to our main partners constantly in terms of, make sure that we can hopefully maintain the level of funding for next year. We got some hopeful news from Denmark, not yet decided, but at least it's good news. Also potentially good news from Finland. So we are hopeful that we can minimize the damage of economic downfall on UNFPA's funding for next year. But as I said, at this point, we are talking in September. We don't know, of course, yet what will happen. But I want to assure the board that one, we are keeping a very close eye on it, and two, anytime we think we need to inform the board, we will do so, certainly through the structured funding dialogues, but even if that is required at extraordinary sessions with the members of the Executive Board. I hope, Mr. President, that will be sufficient for the time being.
I thank you. So I want to thank distinguished delegates, excellencies. I want to thank Dr. Cannon and her team for a really informative and a very interesting. You could see that from the number of questions, statements, comments received. We have therefore reached the end of our interactive segment on the statement of the UNFPA's Executive Director. This is item 12, UNFPA's Structured Funding Dialogue. I wish to inform the members of the board that a draft decision on the agenda item 12, UNFPA's structured funding dialogue, is being prepared for action. We will revert to this item later under agenda item 16, other matters. When we adopt, at which point we'll adopt outstanding draft decisions for this session. So we have come to an extremely informative morning, but before we end or close, I would like to give the floor to Mr. Sam Kearns, the chief executive and board branch secretary there for UNFPA, to make any announcements or remarks that he might have and be helpful at this time. Sam?
Thank you, Ambassador Webson, and thank you, Excellencies and delegates, for joining us this morning. Just to note two things: the negotiations will resume at 1 p.m. as originally communicated. The first item up is UNDP evaluation. There are some other updates on the schedule which will be conveyed at 1 o'clock. So at 1 p.m. on UNDP evaluation. And then the UNFPA segment will continue at 3 o'clock today, first to the item on evaluation, followed directly by item on country program documents. That's from 3 to 5 p.m. this afternoon. And then just a kind reminder to those delegations which have made statements, if they're able to share those on PaperSmart, that also helps us to review them and to go through them very carefully if any points weren't raised. So that's all from my side. Thank you very much, Ambassador and delegates.
Thank you, Sam. So I'd like to encourage members to go to the websites referred to by Sam and others to review more in depth the statements, some of the statements you have heard this morning, and to familiarize yourself with those. I wish also to thank those from Capitals who have joined us and participated in this morning's session. Colleagues, this morning's meeting is adjourned. Thank you.
Thank you, delegates. Thank you, everyone, for joining. Thank you very much, Ambassador Webson.
Thank you.
Thank you, Natalia.